Hello, my name is Alok Sharan. I am the Deputy Editor for Digital Health Transformation at the journal Clinical Spine Surgery. For this week's visual abstract, we chose to highlight an article titled Lumbar Percutaneous Pedicle Screw Breach Rates, a comparison of robotic navigation platform versus conventional techniques, a study performed by Panchmatia et al. In the May 2020 edition of Clinical Spine Surgery. The placement of pedicle screws in the lumbar spine has become a commonly used technique by spine surgeons for internal fixation. While the mechanical strength of the screw is far superior than many other techniques, there are still considerable safety problems associated with this technique. The paper cites a study that reports up to a 41% malposition rate of these screws. With all the critical neurovascular structures nearby, it is imperative to develop techniques that lead to safer positioning of these pedicle screws. There are, of course, many methods to place pedicle screws. By far, the freehand technique is the most common. Surgeons also commonly use fluoroscopy. Computer-assisted navigation, along with the use of a robot, is becoming commonly used as a method now, and the goal of this study was to look at the use of a particular robot, Excelsius GPS, and compare its safety profile versus fluoroscopic screw placement. For this study, 5 orthopedic surgeons and 5 neurosurgeons with experience placing pedicle screws using fluoroscopy were used. Each surgeon placed 8 screws, 4 on the right-hand side from L2 to L5 and 4 on the left-hand side from L2 to L5. The screws on the right were placed using fluoroscopy, while the screws on the left were placed using the robot. To determine the breach rate, the cadaver specimens were scanned using an O-arm. The spines were then disarticulated and manually inspected for breach rates. In addition, X-ray pictures were taken to confirm the breach rate. Ultimately, the results showed that using fluoroscopy, there was a 40% breach rate versus using the robot, where there was a 2.5% breach rate. Lateral breaches appeared to be the most common type of breach. This was an important study as it demonstrated that the use of a robot in cadaver specimens decreased the overall breach rate when compared to fluoroscopic aided placement of screws. While there are certain limitations of the study, clearly this is a good starting point for further research in this.